Now, after completing the topic of femoral triangle, let us continue and study about the adductor canal, guys. Let's see what is the adductor canal. Now, just now I taught you about this triangle here. This triangle is actually the femoral triangle. And I told you femoral triangle will be present in only the upper one-third of the thigh, anterior aspect of upper one-third of the thigh. Then what do you have in the lower part? Now, near the apex of the femoral triangle, remember, it's not going to end here. That femoral triangle will further continue into a canal here. And this canal is actually referred to as your adductor canal. Why? Because that canal is present towards the medial compartment of the thigh, and we all know the medial compartment of the thigh will be having adductor muscles, and that's the reason why the name is adductor canal. Adductor canal. Now you can clearly appreciate the adductor canal in a separate diagram which we have removed here. Yes, this is your femoral triangle, and near the apex of the femoral triangle, it is further continuing into a canal, and this canal is referred to as adductor canal. Fine, you got the clarity. Now one more thing is that you can appreciate in the diagram number 1 over there, the adductor canal above that the sartorius muscle is the one which is crossing there, and that's the reason why the adductor canal is present below the sartorius muscle. It is also known as the subsartorial canal. It is also known as subsartorial canal. And not only that, one more name of this one will be Hunter's canal, guys. Why? Because of that Hunter's maneuver. So there are three names. First of all, learn the names here. Adductor canal. It is also known as the subsartorial canal, also known as the Hunter's canal. Now, once you are perfect with the names, the next thing that we have to learn is what will be the boundaries of this adductor canal. And to learn the boundaries of this adductor canal, we got to take a transverse section at this level. So let's take a transverse section. The diagram will be something like this, guys. Now, the moment you look at this diagram here, I don't have to worry about the medial compartment. In the medial compartment, there is one big muscle, and this muscle is adductor magnus muscle over here. And if you are able to appreciate there, along with the adductor magnus, you are also able to see adductor longus there, guys. So, adductor magnus and adductor longus towards the medial side, medial compartment muscles. Then what are the muscles that you have in the anterior compartment, guys? Try to recall. One will be sartorius muscle, another one will be quadriceps femoris muscle. Sartorius muscle is the one which is cut here. This is your sartorius muscle. Let me just write it here as S. This is sartorius muscle. We can clearly see it is actually crossing over the adductor canal. It is being cut there. That is sartorius. What about the another muscle? The another muscle will be quadriceps femoris muscle. And quadriceps, the name itself is telling you quadriceps, 4 heads. One will be vastus lateralis here, this one. This will be vastus medialis over here. And then in the middle, we'll be actually having vastus intermedius. So vastus lateralis, vastus medialis, and vastus intermedius muscle. In the front of that, you'll be actually having a rectus femoris muscle here, sir. Vastus lateralis, medialis, intermedius, and rectus femoris. All these are the 4 heads of quadriceps femoris. Now, please focus on to the adductor canal. So once you got a clarity, once you have revised all those muscles in your mind, the medial compartment as well as anterior compartment, now please try to understand the boundaries. On one side, there will be vastus medialis. On the other side, there will be adductor longus and adductor magnus muscle over here. And then these two are actually connected by a fibrous sheath there, guys. So that is actually the adductor canal boundaries of adductor canal, guys. So let us just draw the diagram for that one here. So write down the name, guys. First of all, what is the name of this canal here? This is adductor canal. The adductor canal, it is also known as the subsartorial canal. And that subsartorial canal, remember, it is also known as the Hunter's canal. It is also known as Hunter's canal. Now, once you have learned the names of the adductor, different names of that, the next thing to learn will be the boundaries of adductor canals. Now, let us draw the diagram of this boundaries, guys. It will be more easier. For example, this one is your femur. In the transverse section, we are drawing this. This is your femur bone. And attached to that one, for example, this one here will be the vastus medialis muscle. I'm not going to draw like all the heads of quadriceps femoris. You just try to imagine whatever is required, only those only we are going to draw. So this is vastus medialis. And then on the medial side, there will be adductor longus muscle. And then that big muscle on the medial compartment, that is adductor magnus muscle. And then on the other side, what do you have? There will be a fibrous septum which is connecting the adductor magnus with the vastus medialis. And crossing over that will be the sartorius muscle. I hope you got the complete orientation. So we are basically drawing the transverse section of the thigh, and in the transverse section of thigh we are exactly looking at the adductor canal. So let me just highlight, this is actually the adductor canal which I am highlighting here in the yellow color, guys. Wonderful. Now once you have drawn this diagram, let us just write down all the names here and then finish off. So on one side, what do you have here, sir? You'll be having adductor magnus muscle, and then there will be adductor longus muscle. Okay. And then similarly on the other side, what do you have here, sir? This one will be the vastus muscle, and which head? It is vastus medialis muscle. And this one here will be the fibrous septum. In between them, you'll be actually able to appreciate that canal, and that canal is nothing but your adductor canal. By the way, just to complete this diagram here, what is this muscle here? This muscle is actually the sartorius muscle, guys. This is sartorius muscle. So those will be actually the boundaries of adductor canal. But remember, sartorius is not a boundary of the adductor canal, guys. Just beneath the sartorius, there will be a fibrous septum that is going to form the boundary of the adductor canal, not the sartorius muscle. To clarify that one, guys. So I repeat again, on one side you have got the adductor magnus and adductor longus, on the other side you have got the vastus medialis, and then one more boundary of this one will be formed by fibrous septum here, not the sartorius muscle, guys. Now once you are done with the boundaries of adductor canal, what will be the contents of adductor canal right now, guys? And to understand the contents, again let us go to the same diagram here. Let's make the contents of the adductor canal a little bit easier here, guys. Let us try to understand it conceptually. First of all, in the femoral triangle, you'll be having femoral vein on the medial side. You remember that vein artery in the nerve, femoral vein, and that femoral vein is going to pass here, and it is not going to stop here. Remember, femoral vein is also going to pass through this adductor canal. And after passing through the adductor canal, there is one opening there that is known as adductor hiatus. And passing through the adductor hiatus, that femoral vein will be passing behind the knee joint. I am drawing in dotted lines. It is not in front of the knee joint, behind. And we all know very well, behind the knee joint will be the popliteal fossa. So it is the one which is going to become your popliteal vein. So the femoral vein is passing through the femoral triangle and then passing through the adductor canal and then adductor hiatus. It is going behind the knee joint to become your popliteal vein. Exactly is the same with the artery also. Femoral artery is going to pass along with the femoral vein in the femoral triangle, and then from the femoral triangle adductor canal, and via the adductor hiatus it is going to go behind the knee joint to become popliteal artery. Now what about the nerve, guys? Femoral nerve, it's not going to continue down. Femoral nerve is not going to continue into the adductor canal. No. Femoral nerve will stop here by dividing into two division, anterior division and the posterior division. And finally what is going to happen? It will give one of the cutaneous branch, and that cutaneous branch will be saphenous nerve, and only that saphenous nerve is the one which will be going further into the canal, and further it will be going down and supplying to the skin on the medial side of the leg and the foot. So what I am trying to clarify here is that femoral nerve is going to stop there itself in the femoral triangle. It's not going to further continue down into the adductor canal. So don't say that femoral nerve will be a content of the adductor canal. But what is the content? Femoral nerve is stopping there, but the cutaneous branch of the femoral nerve, that is saphenous nerve, will continue further. So therefore, saphenous nerve will be actually the content of the adductor canal. And not only saphenous nerve, one more branch of the femoral nerve, that is nerve 2 vastus medialis, will also be a content. So just by looking at the conceptual thing here, guys, looking at the diagram, you yourself can easily tell what will be the contents of adductor canal right now. Femoral vein, femoral artery, saphenous nerve and nerve 2 vastus medialis. All this will be the branches, or all this will be the contents of adductor canal, guys. So let us just write the contents here and finish it off. So what are the contents of adductor canal, guys? Femoral vein will further continue below. Along with the femoral vein, even the femoral artery is also going to continue below. And in fact, both of them are going to cross the adductor hiatus and going to become the popliteal artery and popliteal vein. And then along with that, the saphenous nerve will also be the content of adductor canal. And along with this, the nerve 2 vastus medialis. This is also the content of adductor canal, guys. So that is about the boundaries and contents of adductor canal. I hope even this concept is made easy, crystal clear here, guys. So all the boundaries you can easily study with the help of this diagram given on the screen there. And the contents, I told you conceptually how to remember them. They're actually the continuation from the femoral triangle itself. So it's always better to learn that the topic of adductor canal followed, by femoral triangle only. So once you learn about the femoral triangle, followed by that you learn about the adductor canal, the things will become a little bit easier for you guys. That's all. Thank you. Done.